Probably the biggest challenge is that the current diagnostic kits are in the wrong dynamic range. What that means is that the current diagnostic tests are to tell amplified HER2 gene amplified um, cases from non-amplified cases. So that's a lot of molecules. That's like telling, maybe 500,000 molecules from a million molecules or 2 million molecules. HER2-low is more like 30 or 40,000 or 100,000. So it's orders of magnitude lower, and the test isn't designed to work in that range. So what we're trying to use a test that's sort of retro-engineered or reverse engineering a test that isn't designed for the right dynamic range. The analogy has been that it's like trying to weigh mice on a scale built for elephants. And if you do that, you don't get a very accurate weight of your mice. And that's the problem. In fact, and that's what we see. We've done a couple studies that have shown that pathologists really can't very accurately distinguish 0 from 1. And the 2 and 1 is considered HER2-low and 0 is considered HER2 negative. But we can't tell the zeros from 1. And even if you spend time studying training the pathologists, and you look at pathologists from all around the world, there's a paper in ESMO Open from Beppe Viali, and the best we can do is about 80%. And 80% isn't usually good enough for patients. And if I'm a patient, I want to have better than 80%. And if you compare that to other companion diagnostics like EGFR and lung cancer for EGFR tyrosine kinase inhibitors, the reproducibility of that test, which is a molecular test, is 99%. So that's more in line with what we should be able to do. So being asked to distinguish 0 from 1 is already bad. Now they're asking us to distinguish a half, basically to tell a half from a 0. And I'm not sure who designed the study, but it's certainly not designed in the, it's not well thought out, because we already couldn't tell 0 from 1, and now we're supposed to tell half from 1. So it's baffling to me that that they would move in this direction, and I don't understand why they're having a companion diagnostic test at all if they're trying to get quite so low. And maybe that's the direction they'll eventually move to. But we see that that the current desire to distinguish HER2-0 from HER2-1 or HER2 less than 1 greater than 0 is probably unrealistic, and it embarrasses the field of pathology. Not embarrasses, it offends the field of pathology, because they're asking us to do things that are not humanly possible in order to make money on their drug.